Hi, my name is Mrs. White. I'm a health career pathway teacher at the Chester County Technical College High School.
Hi, I'm Miss Compton. I'm one of the Health Career Pathways instructors at TCHS Pennox Bridge.
I'd like to share with you my opinion on health insurance. I believe that more people need to have access to health insurance. I believe that healthcare insurance needs to be more affordable, and I believe that everyone deserves to have healthcare no matter what their income is.
I think that health insurance is good for everybody to have access to. I think that it is beneficial for everybody.
So to make it better for health insurance to be available to everyone, it's pretty much a very difficult process. I think the best thing that we can do as a whole is to talk to our local officials. It really is something way above the individual person. One additional thing that we can do is to provide free services locally. Places like La Comunidad and the CVIMs, the Volunteers in Medicine, they are people that are volunteering their time to help others that can't afford or don't have health insurance.
So I think that we should work out a way that everybody has access to health insurance, but I also think that we should try and figure out a way that it could be more cost efficient and effective for everybody so that they can gain access to it and it not be thousands and thousands of dollars for people.
So for government involvement, there is a lot of resources through the government, funding and what have you, through the federal and state governments with taxes, etc. However, we think we need to lower the costs of healthcare for some of the testing, lab testing, radiology testing, and definitely with our drug companies costing tons and tons of money for medications for people that can't afford it. So there are some things that we could do.
So I think if the government is involved in deciding about health insurance, I think that they should have medical professionals that they consult, because I think it takes people who work in the profession, who are dealing with health insurance on a daily basis and who are working with patients that actually know how health insurance is affecting them. Government officials don't always seem to know how it could affect the patient because they're not directly working with the patient. So I think that there should be a lot more medical personnel involvement in the process.
So with our current president, I'm not sure if anything has really changed yet, although I do hear that there are some talks about changing our health care. I know our previous president put a lot of good things in place to make health insurance affordable for everyone. So I think we just have to wait and see where this is going to go. I'm hoping that we at least stay where we are and not lose any coverage for people.
I think that each president tries to do something with healthcare, tries to change it in some way, but it's not always effective, it's not always reaching all of the people, and is not always quite what it's intended to be.